Well, good afternoon, everyone. And we want to welcome you to this healthcare community forum here. We appreciate all of you turning out on this beautiful Saturday afternoon. Where I understand we're also live streaming, so we're here in Perryville, Missouri. We have two panelists here today, and we appreciate their being with us. Dennis McDonald is with the Missouri Healthcare for All, is a statewide grassroots organization that believes that every Missourian deserves access to quality, affordable health care, regardless of where they live, how much money they make. He is the Jefferson County and Southeast Missouri organizer. Welcome today.
Thank you.
We also have with us Kathy Ellis, who has worked professionally as a licensed clinical social worker and addictions counselor for over 35 years. In addition, she serves on numerous boards and local committees as well. We welcome her here today too.
Good to be here, thank you.
We have a number of questions. We want first to be answering your questions today. We also have a number of questions that have also come in to us in preparation for the event. We also have some answers from some healthcare professionals here in Perryville to some of those questions as well. And I will be adding those in today as well, so we'll be hearing from them. The two people we have are Dr. David Melchior, who is with the Perryville Family Care Clinic, who is answering some of our questions. He's a doctor of osteopathy and also certified in family medicine. We also have questions being answered by Patrick Caron, who is the president and CEO of Perry County Memorial Hospital. We appreciate his answers also. He has a background in a science degree in nursing. He has a master's degree in healthcare administration. He's also completed a fellowship in healthcare administration in 1989. He has been the CEO of the hospital since 2005. So we appreciate his taking time to answer a number of our questions also. Now at this time, I'll turn our meeting over to our panelists, and I understand they're going to spend a little time introducing themselves, and we'll be taking your questions as well.
All right, I'm Dennis McDonald. I'm the Jefferson County and Southeast Missouri organizer for Missouri Healthcare for All. I'll tell you a little bit more about our organization. Again, we're a statewide grassroots organization, and we're bipartisan, and we push for anything we can that will help improve the access to Missourians' healthcare. So obviously right now we're focused on the Medicaid expansion. That's a big deal for our state. I'm sure we'll talk about that as we go through the questions. But there's also things like surprise billing, other issues like that we can work on in Jeff City. But one of the other things we do, and probably the best part of my job, I think, is meeting people and having them share their stories and their stories about healthcare in particular. Because one of the things we found as we've been doing this is people don't know that their neighbors are dealing with these issues. They think they're alone. There's a sense of shame of dealing with these healthcare issues, whether it's being uninsured, underinsured, how do you navigate the system, those kind of things. So we try and bring people together to share their stories, and that's why we really like meetings like this, because people can recognize that they're not in it alone, and that it's a problem that's across the state from the rural areas to the urban areas. So one of the things we're trying to do is get people to have a conversation about that. And so that's kind of why I'm excited that I was asked to be here today, and hopefully I can help answer some of your questions and kind of moves in the right direction to solving this problem. Because again, it's not a simple crisis, but it's something that affects everyone. So.
And I'm Kathy Ellis, and I'm running for the Missouri 8th Congressional District, which is a very large, very challenging district. And having been in the mental health field and the addiction field for many, many years, I have many stories about how the system has failed us as human beings and people as patients. And so that's one of the things that I have always been committed to, is how can we provide these services to everyone so that they have the opportunity to live a good life, and that they don't end up bankrupt because they have a $500 health bill that they can't afford, which is trending again. It was going down, and now bankruptcies are back up, particularly in this district. We're seeing it an awful lot with the farmers. Now that's a new area where they haven't been able to afford health care, but with that comes a higher suicide rate. So we have so many problems that are so interconnected, and what I see is healthcare is that centerpiece that we need to focus on first. And so that's one of the things that I'd like to talk a little bit more about as we go ahead today.
Well, we have, after our introductions, we would like you all to tell us a little bit about your concerns and needs. We have, do I understand that we have some way for you all to refer back to us who you are, what you're working on in regards to healthcare, what your issues are too in this time. Now, we have a number of questions. Are we ready to move toward answering questions from our audience at this time?
Sure.
Okay. This is meant to be for informational time, so we would like you all to be part of this discussion as well. Yes.
How can we get healthcare providers, excuse me, to say up front what a procedure is going to cost, what a visit's going to cost, so people know before they make a commitment how much it's going to cost?
Well, the first thing that I always do is call and say, if I have to have a procedure, how much is this going to cost? How many people are going to be involved here? Because something as simple as a colonoscopy involves the surgery center, it involves the anesthesiologist, it involves the nursing care, it involves the physician that does it, it involves all of these different aspects. You don't hear about that until you get the bill. So I think as consumers, we have to make sure that we take responsibility for finding that out. What we're also seeing a lot of, and I got one of these bills after having a colonoscopy, it was $500 for an anesthesiologist from Florida. And so I called United Healthcare, which is where I have insurance, and they said, you don't have to pay that. I said, why not? He said, because they are billing you to try to make up the difference. This is a company that employs anesthesiologists in Florida and spreads them out all over the country. And so you'll get these bills that look like they're the real deal, that you should pay them, and you don't have to. He said, I'm going to put that in your notes, in your file, so that you don't have to pay that, and I didn't have to pay that. So it's a sad state of affairs that we have to be so on top of all of these things all of the time. But that's in the current system, that's what we have to do.
If you call and ask how much an MRI is to different places, some will tell you, some won't.
Right, right.
So
And it's probably a good idea, don't go to the ones that don't.
why is that not a law that they
It should
have to put their prices out to the public for everything?
Yes, it absolutely should be. But if we can move toward a single payer system, that's stuff we don't have to worry about. So, we have to really look at, this is something that is, we look at it now as an enterprise. This is how people make their living. And if they don't feel that they get paid enough, then they find other ways to do it.
Kathy, if that single payer system is not managed properly, we're all going to be paying for that anyway in the price of, even if we get single payer, those companies are still going to bill. How do we prevent the single payer system from paying for things that we didn't pay, that we didn't ask for, that we didn't need?
Well, I think one of the things that we're going to have to look at is some sort of transition into when we have a healthcare system. It's going to take us a long time to make sure that we have everybody covered. And it's going to take a longer time to realize what administrative needs that we have in that newer system. So I think that we can really, focus on how do we keep this from happening by looking at what we've got going on now and setting aside some legislation that this is how it's done properly. And this is how we can remedy this.
Yeah. I was gonna say, we have a pretty good example of what it could look like when we have, one company who, Medicaid and Medicare have lower rates of fraud, waste, and abuse than any private insurance. So we already know, like I said, there's already a model of how we could do things. And yes, we want to look out for those things, but I think we already have the expertise and the knowledge of how to approach and kind of watch for those things. I think we already have that. And just going back to your question, I think Kathy are a really important thing here. We could go to the same office on the same day and see the same person and pay a totally different rate. That's why they don't answer the question, because they may not know. It depends on your insurance company versus my insurance company. Is that person in network for you? Are they out of network for you? You know, you can go in for your colonoscopy or what would seem like a regular procedure, and then all of a sudden you need something, and the anesthesiologist or the ER doctor's from a different network, and all of a sudden you're paying thousands of dollars you didn't expect to. And I agree 100% people should understand what they're getting into, but with the reality of our system as it exists now, there's almost a perverse incentive for them not to do that, because people can make incredible amounts of profit from not letting people know what they're in for. So, if that makes sense.
We have cards that are, I'm sorry. We have, I just want to mention, along with this, please, I'd like you to continue. We have cards that folks are now writing us questions, so please see the cards around here and give us more questions. Yes.
We already know that Medicare and Medicaid are a giant mess, and that's gonna have to be straightened out. And how in the world can we manage to straighten that mess out without just taking it apart from the bottom and people don't have health care while we're working on it? It just seems like it's, you know, us against them is not gonna work for this, because they've got the power to run the company into the ground, as it were.
Could you tell us a little bit more about what you have personally found in that system that's been so flawed?
Well, when my father died, he was on Medicare because he was old, and, you know, you have to have it a certain age to make you take it. And the way that Medicare paid the bills cost money up front because they didn't pay on time and things like that. So if they didn't pay on time, of course, then that penalty got put on him. That penalty wasn't on Medicare, it was on him. They refused to pay the penalty, so we had to pay them. We had to pay them in order to clear his estate. And that, you know, that one thing right there can cost some families every dime they have.
Right.
So how do we get control of Medicaid and Medicare in the meantime?
Well, you know, I think that what we're looking at is a lot more things have been put in place to keep that from happening. Let me tell you just one example of that. This is not with Medicare, but it is with the federal government running the community health centers. I sit on one of those boards, and the level of oversight that we've got going on right now is excruciating to the people that are working in it, in that system. But it's fantastic for the people who are the patients, because we're looking at how can we make sure that people are getting paid what they need to be paid as the provider, but also to make sure that when there are mistakes, that is something that is taken into account when we have our every 2-year evaluation. So if you don't get 3 or 4 things right on the evaluation, you will no longer be able to serve patients. That kind of a structure, when applied to Medicare, I think is going to be very beneficial, and they're moving into that model right now. I know there've been, you know, people have a lot of issues with any kind of provision of care, but I think that there's some movement in the direction, if we can keep moving that way, that it will also fall into that category where you have very stringent ways that the providers have to behave and have to do things, and that system has to behave.
There are a lot of issues related to the current system that we have in place, aren't there?
Yeah.
And one of our questions is related to the current system is that the Affordable Health Care Act is still in place. If it were overturned, how would people with pre-existing conditions be protected?
Even if it's not overturned, they can stipulate that they're not going to continue to have pre-existing conditions covered. That's just cut out. That's what's being sued by all of the attorney generals, including ours, in this state. They want to get that out of there. So
it wouldn't even have to go to the point of repealing the entire.
No. And you know, I think that the Affordable Care Act has gotten a lot of bad press. I think it made a lot of mistakes, and I think the rollout was too fast. And I don't think people began to really understand how this would benefit them until it was sort of plopped, you know, on their plates. But I think that we have the opportunity, if we want to move toward a single payer, if we want to move toward Medicare for all, whatever you want to call I think we have the ability to use our community health care system as well as affordable care and fill in the places that don't work, fix the things that are broken, begin to provide more services to more people. But all of that will take time. I think, there's a lot of talk about Medicare for all, and I think ultimately that is a viable idea, but we have a lot of work that we need to do in order to make that transition. So I think we can do it, but I think it will take a while for that change to occur. And we're beginning to see people don't take my ACA away now. I don't have anything else. So let's expand that. Let's expand Medicaid. That's one of the things that's going to be such a benefit to this state. I mean, we're leaving millions and millions of dollars, billion probably, on the table right now. We could provide those services today. So we have some things that we need to correct before we move forward.
I think that's an important question. What was it? Well, we just ask ourselves, what was it like for patients with pre-existing conditions before the ACA? And why didn't they have protections before the Affordable Care Act? Do we really think they're going to keep them around? And when you talk about problems with the ACA, obviously there are problems with it. And one of them, for example, is in a state like Missouri, one of the big benefits would be saving our state money by expanding Medicaid and covering those people. Our state didn't do that. So a lot of people who live in our state, they see their neighbors without insurance, they see their kid aging out of their insurance at 27, they see their people they know not having access to insurance, and they wonder why. It's because, and then they say, well, it's this Affordable Care Act, when it's because we didn't kind of do our part, if that makes sense, as a state. So that actually makes it look, a lot of people are confuse that problem and say, well, this is terrible, didn't really do anything. Well, it would have had an amazing impact for hundreds of thousands of Missourians that really needed it. And as you said, we're actually paying more money now to cover less people. The reimbursement that we get from the federal government for our Medicaid cost is around 60%. If we would have expanded Medicaid 10 years ago, we're still getting 90% of that taxes that we're paying coming back to our state. We're just throwing that money away and having it for 10 years. So
And the big thing about that is we're paying for everybody who's surrounding us, every state surrounding us.
Right.
We're paying the bill for them if they have Medicare, if they have Medicaid expansion. So, the thing that doesn't make any sense to me is we know if we have healthy people and we have a system that provides what they need, that we will have a healthy economy. And if people want to go to the cost of what these services might be, our economy will benefit from having people who are healthy, who have access to health care, and who have a system of how do you deal with it when it goes wrong. We should have a system that will really look hard at what happened to you. That should not happen again. Those are the kind of stories that we need to hear in order to really get a sense of, okay, this needs to be fixed. This is another example of what needs to be fixed. And there are a lot of them.
Many of our questions relate to primary care, but a lot of the questions too, I have two here, are moving toward larger health issues within our particular district. One is, how large of an issue is mental health access to the 8th district?
In most areas, it's non-existent. And, we have several community health centers that provide comprehensive services. The one that I'm on the board of has primary care, dental care, behavioral health, and drug and alcohol, which is one of, I think, 2 in the state that provide all of those things. The goal is to expand, the community health center system throughout our district so that it provides all of those services. And there is no reason that can't happen, and it should have happened a long time ago. What we're finding is that we are a sicker district as a result of our health care services. We have an amazingly high rate of STDs, specifically syphilis. We have really no place that people can go to get those services. If they do, they have to wait. We have mental health issues, opioid addiction, and other addictions that are through the roof. And no one seems to be very concerned about it. I've worked with people for many, many years. What I know about addiction is if you have the right services, you can recover. What I know about mental health is when you don't have those services, you're going to have a very, very, very difficult life and those around you, and you may even kill yourself. We have an extremely high suicide rate. This district, we all know it's the 11th poorest one in the country. It's moving into 10 very quickly. And right now, with the loss of our rural hospitals, you know, people are like, you know, I'm just going to die then. It is not unusual for me to hear from farmers in some of the far corners of this district that I can't afford my health care. So if I have something awful, I'm just going to try to get enough pain medication. I can't get it from the doctor. I'll get it from the guy that sells the opioids on the corner. And he said, when it comes my time, I'm just going to go in my field and shoot myself. I wish I could tell you how many times I heard that story to varying degrees in our district. That's not right. What's wrong with this country? That 1% of the people control so much that we have to have people who resort to that extreme just to help their families. It's not right.
Why would you, that's obviously your area of expertise, and I appreciate that, you know, sharing that insight. In the broader spectrum, I mean, obviously I agree with everything you're saying. It's, for me, I'm going to say this word a lot today, is access, and I think that's kind of what you're talking about. And again, these kind of things, whether it's access or whether it's, you know, the cost of doing this, the cost of covering uninsured people versus the cost of not doing it, we have lots of evidence that it's really better, not only moral for our society, but it's the better thing to do long term. You know, healthy people, they stay in the workforce, they work harder, their families are healthier. Every outcome that we want for our neighbors requires access to health, whether it's mental health, which is obviously an important one as well. And not having access to that, you know, we may think about the cost. You know, just think of just overcoming the stigma of people going to get help when they need treatment for something. And then we're going to put up a cost barrier as well, right? I mean, it's insurmountable for so many people. And again, like I said, there's lots of other places that do this and do it well, where we can see the evidence that it's actually worth doing, and not only morally but physically. So to me, it's 100% no-brainer.
You all are anticipating one of our questions, first questions, regarding the existence of healthcare deserts. What do you see as the major cause of the closing of so many rural hospitals? I have some information that both Dr. Melchior and Pat Kieran gave on this too.
Well, you know, when you only see people that don't have the insurance, you're going to run up a lot of debt in a small hospital. And so I think that there have been opportunities where, you know, there's been money that has been given. According to the ACA, there were hospitals that were being supported by the federal government. And one of the stipulations, if the ACA was left intact, they would be able to take away all of the charity cases that would be covered by people who got the Affordable Care Act insurance. But what happened? A bunch of lawyers came in, took it to the Supreme Court. They said, well, the healthy people, you know, because they said everybody should, you know, have health care. They should be responsible for, you know, paying for the health care. And so the Supreme Court says, no, that's not right. We're not going to let you do that. If you want to opt out, if the state wants to opt out, they can opt out. If an individual wants to opt out, well, guess what? The healthy people, the 25-year-olds that think they're going to live forever, opted out. So then we have that same cycle of we're paying again for people that are very, very, very ill, and we don't have the resources for it.
May I read you what Dr. Melchior responds with, and it seems to be very much related to what you're saying. He says, critical access hospitals like our hospital, PCMH, were to receive Medicare allowable costs plus 1%. After the sequester of 2013, a 2% decrease took effect and continues until 2023. So commercial insurance companies have continued to reduce reimbursement The cost of providing health care, however, continues to rise. Thus, it's inevitable that such business cannot be sustained.
And you know, if we had the single payer system, we could negotiate. We could bring these, you know, pharmaceuticals, we know what's going on with that. That's absurd. But right now, as it stands, we're not doing that. And I keep asking, why are we not doing that, even now, before we move to something new?
Here's Pat Karen's answer. It follows Dr. Melker's in some ways. Financial difficulties resulting from government payers paying below the hospital costs, combined with increased bad debt and fewer profitable insurance plans. He's an administrator, so he's seeing that side of it. Recruiting healthcare professionals to rural markets is increasingly challenging. Healthcare is overregulated, which costs hospitals. In the end, each community has their own unique mix of these and other challenges that lead to financial difficulties. Any response there?
Yeah. First thing I was going to open with, one thing I've learned from doing this job is it's different and tough to practice medicine in rural areas. And I think that, we've heard each other from people that's, and I appreciate that. But that last answer brought up a really important point, and they framed it in terms of overregulation. One of the things that really hurt the hospitals, and one of the reasons that those private insurance companies have fled, is because part of the dismantling of the ACA was taking away the regulation and the risk corridors that those private insurance companies were going to depend on to pay for those expensive people to cover, right? So naturally, once that goes away, running our hospitals like a business model, they're going to leave, and that left the hospitals with the most expensive patients, with no insurance, or getting the Medicaid payments or the Medicare payments a little bit lower. It's, again, thinking of some of these questions, healthcare is an inelastic demand. People need it. They're going to pay what they can pay. They're going to pay what they have to pay for it if they can. If they can't, they're still going to go to the hospital in the emergency room. Whether it's something they could have got fixed 10 years ago for cheap, that's now tens of thousands or hundreds of thousands of dollars. So I mean, we're asking people to make a choice about something like that, and I think that's, the hospitals don't deserve to close for trying to do their business either, but, as far as serving the public. But there's been a lot of things that have happened over the past 8 years, 7 years to kind of really undermine the pillars of what those hospitals depend on, and I think we should be doing everything we can to help them. And part of that is, I don't want to keep saying this every day, all those people that don't have insurance could be getting, ask a rural hospital which is closed if they'd rather have a Medicaid payment or no payment. They're going to answer the Medicaid payment. I don't think they're going to blame that. So again, we can address those issues moving forward, but there's a critical issue that we need to address immediately if you want to attack this problem.
And I think, some of the statistics are that there's a process called matching. When somebody gets out of medical school, I'm going to my niece's match day is on the 20th of March at the zoo, and it's a big deal, and the whole families get there because they find out where they're going to get to do their residency. Now, we don't have enough residencies for the number of physicians that we have, and we have about 3,000 people that are, medical doctors who don't have a residency. Well, wouldn't it be a great idea if those people were given the opportunity to get rid of some of their debt by working in a rural area? That's what we do with the community health center system. The dentists, when they sign on for 2 years after they get through all of their training to be a dentist in a community health center in any place in the country, they will receive, after that, they sign on, they get a bonus in the beginning, and then after that first year, they're going to get $25,000 to offset that debt. The second year, they're going to get the same thing. And so what we found is about half of the people who are dentists stay because they like working with those clients, and about half they can go into private practice. But it's something that we can also do with how do we get these physicians to go into these areas. Some of them are going to stay because, this is what they want to do. They want to work with people no matter what. Some of them are going to leave, and that's fine. But if we can help them offset some of their debt to serve the needs of our communities, I think that's a great idea.
I want to continue, urge you to continue bringing questions forward that you have as well. Here's a question related to more of the nuts and bolts of the plan itself and the differences between the plans. Can someone explain the difference between single payer and public option healthcare?
Sure. I'll do my best. So we're really, there's a couple of different things, and I want to bring in a couple more just to kind of broaden it a little bit, but I think it'll help folks make sense of this. And that is, because especially we hear these terms all the time. I don't want government-run healthcare. I don't want socialized medicine, all that kind of stuff, right? There's a difference between all of these. When we talk about single payer, we're talking about one insurance company, right? Medicaid, Medicare, or insurance, right? Like Kathy brought up, things are negotiated between the providers and the Medicare and Medicaid. That's all paid for by the taxpayers, right? So whether it's the taxes coming out of your wages or your employers match a lot of contributions for a lot of things. That's an insurance situation. The public option with a single payer, that's it, right? That's the only option. It's very much like what Canada has, right? Canada has a single payer. Everyone pays in. They then negotiate with their providers. A public option, we would keep the system we have as far as having public or private providers and private insurance companies, and there would be an option for folks to either buy in if they choose to, and again, it kind of depends who you talk to, but basically try and have both systems coexist, right? Or you have kind of what the British have, their National Health Services, kind of all the way on the other extreme. The government owns the buildings, they pay the doctors directly, they kind of control that kind of stuff. So there's a wide spectrum of options when we talk about how we're approaching this problem. So I know that seems kind of convoluted, but the basic difference between having a public option and single payer is with a public option, you maintain a private system. With a single payer, there's basically one insurance company that's paying everyone, we're all contributing. Whereas with a public option, Kathy's job may have a really large pool, right? If you work for, California State Work Directors, I'm sure there's 6-7 figures of those folks, right? So when they go negotiate their prices for the insurance plan, they have a bit of leverage, right? Whereas I work for a small rural community college, maybe we only have 50 employees, we're not gonna be able to get the same deal, right? That's something we run into all the time. So, that system would maintain itself. With a single payer, everyone in the country is paying either the same, and we're negotiating with that amount of people. Does that make sense? So it tends to drive the cost down a little bit. So, does anybody have any questions about that? I don't want to leave that because I think it's important because we mistake a lot of these terms and people, it's hard to, people get passionate about this, rightfully so. We really need to understand what people are talking about.
Well, let's bring up the S word too. Let's talk social.
Yeah.
We have one socialized medicine group in this country, and that's VA. The VA.
The VA hospital system.
Yeah, and
Horror
now
stories we hear about.
oh yeah. There's stories, and there are stories that are good. I mean, I've heard about as many good as bad about the VA. Again, when you have the resources, we're talking about, let's face it, for as much as we pour into the money into the healthcare system, we have very poor healthcare. And, the people who are supposed to be watching that, they're chopping them out of the system. We're in a massive restructuring at the federal level about people who are working in agencies that they've worked in before. There are less of them than there were 2 years ago, 3 years ago. So that's not benefiting anybody. Now, that doesn't mean that there aren't some people that, really do need to, go for the door, but the reality of it is, when you have a system and you want to manage it, you need to have a certain level of personnel with expertise to make sure that happens. And right now, we don't.
This is related to that is one of our questions that the myths that we have related to healthcare and various forms of it, and the S word, as you put it, socialism. How do you feel about rationing healthcare? Because this is an immediate criticism. If you make this available to everyone, obviously you're going to have to start rationing it one way or another. Dr. Melchior says one doesn't feel good about that. However, what in life does not need rationing? We only have so much time, energy, resources in a day. And Pat Carrot follows up, I feel any mention of the rationing of healthcare is viewed as negative. The problem without placing boundaries around healthcare when publicly funded is that one individual can choose to spend a huge amount of society's healthcare dollar in a way that others in society feel is wasteful or little or no benefit. The concern is how do we apply appropriate healthcare to where it is most needed? Would you say that's the concern you're getting at?
I would really like a little more clarification
think what, if I can see this, as basically, the assumption is that if you make healthcare available to people and they do not have to pay for it, therefore certain people will immediately abuse the system by asking for services that are not needed. I think that's the nature of the criticism that's being heard. Am I correct in
So that tummy tuck isn't really necessary.
Yeah, that's how we do it, yeah.
We ration healthcare now,
Yes.
right? I mean, people that can't afford it
Don't
are
get-
rationed out. You know, I mean, someone who, I didn't have insurance for a really long time. You just don't go to the doctor. I mean, you're rationed out and there's nothing I can do. So I mean, and I have a problem with the idea that people are going to seek kind of, oh, geez, I haven't had insurance for 20 years. Finally, I can go get this stuff. No, people want to get their blood pressure medicine. They want to get their diabetes medicine. They want to get, their knee fixed. They want to get those things that have been ailing them for decades that they haven't been able to get looked at. And I think, the whole idea, I just, again, I don't want to step you right on, but I have a problem with the idea that people are going to somehow go and seek care that they don't deserve. And I think that really speaks about our society, that we would want to have a world where, I work at this job, so I have better health insurance and I deserve it, but the person who's making my hamburgers somehow deserves less. I really have a problem with that way of framing something as important as health.
Yes, thank you.
Sir, did you want to go ahead and?
Yes, this idea that we're not paying for our health care with a single payer, Medicare for all, whatever system that we're choosing, because in the end, we are paying so much more for premiums right now, and then out-of-pocket costs on the system that we're in, that I think it's a misconception, this idea that we won't be paying for healthcare when we're still paying in some sort of monthly tax to support this system. And that what we really need to be focusing on is a redistribution of this wealth from the people at the top that tell us we don't have enough resources, when the billionaires and 1% have enough resources for all of us. And it's time we start talking about that, and that there are enough resources for the people in this country. It's just that we are not the ones that have it.
Mm-hmm.
I'm going to send something around here. This is from a group called Fix It Healthcare at the Tipping Point. It's an organization that's pass it. If anybody wants a copy of any of this stuff, just make sure we've got your address. I can make copies and send it to you. But Medicare improves American life expectancy. This is another one that's kind of shockingly interesting.
Can I add something as well? I am not a panelist, but I think maybe one of you could speak to, we hear this a lot about the rationing and people overusing the healthcare system. And my first thoughts, the thing people always bring up is plastic surgery, is which people have medical reasons for that, but that's always the question. But that is not a part of these proposals. So things like Medicare for all, no one is proposing that we pay for people's unmedically necessary nose jobs. So that's important. But I think too, maybe one of you could talk about preventative healthcare and healthcare outcomes, because that's my first thought, is when we think the overuse of the system is, oh, God forbid someone gets their every year checkup, and how much better of a society we would be if people had access to preventative healthcare, and how that impacts costs in the long run.
And the biggest impediment in our district is transportation.
Yeah.
Because we did a drill down into our health center and any of the other people that were providers in the area. And what we found was when we asked a patient who had been treated they were using diabetes and associated diseases, the high blood pressure, heart issues, why you didn't come back to that second appointment to make sure that your medicine was working. They did not have any access to any way to get there. So, this is such a huge issue for our district, because that's in Jefferson County. That's not exactly there are no cars there, and there's not a public transportation, even though they're tiny. Somebody said, well, why don't you, this was somebody that was in the city, and I was talking with them, and they said, well, why don't you just, get Lyft or Uber? I said, oh yeah, there's a lot of those in Jefferson County, a lot more in Ripley County, way down. So we've got that to deal with too. So, that's one of the benefits of it. If you've got a group of people that are very dedicated, particularly to community health centers, we're working with the county government to try to provide transportation services for our patients. Now, the other thing that I would comment about is this idea about, rationing. We should not, it's not about the facelift. But I will tell you, if you have good mental health care, you will be able to find the people who are somaticizing their mental health issues into their bodies. And so you'll see people that because they're lonely, they will want to go to the doctor or the nurse practitioner, because they just want somebody to talk to about what's bothering them. So much of what happens in our bodies starts in our heads, and vice versa. We are impacted by that greatly. And if we don't have good mental health care, and I'm extremely alarmed by what I'm seeing. We had a period of time with you when the Affordable Care Act first started that mental health and drug and alcohol were viewed as any other disease. Now they're carving it out again. They're saying, oh no, we're not going to cover that because, you've got this pre-existing condition. So they're going back to that same old thing. So we're going to have more people who are sicker as a result of their mental health issues than we've had in a few years. And believe me, the one time that I absolutely went ballistic on the phone with an insurance person was when I had a suicidal client. There was no doubt that was going to happen if something didn't happen. And so they happen to have some of this bullshit, insurance that they're selling now that gives you a little bit for a few things, and then they say, oh, this is going to cover, just talk to your doctor about this, and then you find out you owe a ton of money, and it doesn't cover anything, and it sure doesn't cover mental health. And so, so here we were, I'm like, I've got this suicidal client in my office here, and, I will have to call 911, and we'll have to go through that. That's going to cost money for them to get the ambulance, of course. I said, what do they have, as I was talking to the woman on the phone, what does this person have in terms of care for a 2-day stay in the hospital, stabilize and see what's going on, at least get some medication on board? Oh, they don't have anything. No, that's not included in their plan. I said, okay, so what would you suggest that I do? She said, I would suggest that you tell them not to do it. Tell them not to kill themselves. I said, I need your supervisors. So I finally got through to, and they gave me some information about that really didn't amount to anything. So we had to go through that process of trying to get somebody who didn't have the coverage. They had the bill that they had to deal with. What's the choice? Do I pay a bill for a long period of time? Or do I just kill myself? Unfortunately, we're seeing more of this.
You raise a really great point. If you think about what insurance is supposed to do, we're supposed to pay money, whether it's our employer, there's a whole other issue, but somehow we are working, we're paying, whether it's through our work or whatever, into this system that when we need them, they're supposed to be there to help us, right? They're supposed to pay this exorbitant bill, they're supposed to help us for this problem. And with the model, with the system we have now, the model is try not to help as many people as you can if you're an insurance company, right? I mean, that's their business model for profit, whether we like talking about it or not. And the conversation we're having is, where do we draw, not necessarily, I'm not putting blame on us, I'm saying as a country and as a state and as a district now, is there a line where we say these people don't deserve this, right? I mean, that's what we're really talking about. All of these questions to me fundamentally ask that question. Is there a group of people in our county, in our state, in our town that go to school with my kids that I'm okay with them not having insurance? Like, it's okay with me, right? Like that, because we can't do this. And I have a problem with that. I just think we can do better. And I think I said it before. There's lots of evidence, lots of places. We talk about access to issues. I mean, think about what states like Colorado did with access to birth control and kind of exams, right? Like, they had this problem. Let's do the rational, thoughtful thing and give people access to them. Whoa, what do you know? STDs are way down, right? I mean, we can fix these things. They're not insurmountable problems. I think we just have to kind of look for the answers. Again, I think everything we've talked about today is raising that point, right? I mean, it's what do we want of our insurance companies, whether it's private, whether it's not private, whether it's a mix of a public option or whatever. You know, those are great conversations, but fundamentally, what do we want insurance for? How can we make it do that for everyone, right? Like, I think if we start there, kind of, I don't want to say it's easier conversation, but to me, it's more focused on what we should be focused on.
I have a question for everybody. Do you remember back when the tobacco industry was supposed to give a certain amount of money to states? I don't know how many years ago it's been. Well, there was supposed to be a fund that was established that was supposed to be used in Missouri for specific kinds of things, dealing with, making sure that people, were dealing with their, with whatever their health problem associated was, and with prevention, and a lot of stuff like that. Well, it's sitting in a little fund in Jefferson City. Not too much has been extracted from it, and nobody really needs to know exactly where it went, but it's a little bit there. We now have the opportunity with the opioid decisions. We have about $300 million that's coming to our state. Okay? And out of that, they've done it the right way thus far, but they are establishing a committee of people that are engaged in, the addictions field and things like that, to determine how that money is going to be spent. You can apply for a grant for varying things or varying amounts of money. I would be so careful to make sure that I call my legislator and find out what they're really going to do with that money, because I can see that being thrown into a little pot that they use for something else, like tax credits for millionaires, and and then we're left out in the cold again. $300 million in Missouri is not going to touch the opioid epidemic. It is not going to provide what we need. We know if somebody's is addicted to opioids, they need a year in some sort of a treatment in order to begin to realize that their brain is not telling them the right things. That's what it takes. And in this country, we do not have, I don't think we have the will to do that. I don't think most people care. Because this is one of those illnesses that people will say, oh, they brought it on themselves. And that will be the excuse. So if you find out that we're getting any settlement for anything, you be on the back of that legislator like crazy to make them find out, get the information where that money is going and when am I going to get some of it.
One of the problems with that, Kathy, is the same problem that we're having with our current congressperson in DC, is that he doesn't care, number one. Number two, he never responds.
Right.
He just, once he was forced to open his Facebook page to everybody again, he just stopped responding. We don't even know if he's getting our mail. We have no way of knowing.
Yeah.
And that's the same way with that.
Speaking of the,
Just one more thing, I kind of wanted to touch, because I feel like I didn't answer your question that you asked about preventative medicine.
Oh,
But I think
Yeah,
that's kind of,
That's
I think, the opioid crisis is again something that far too many people in our state, far too many people know someone, a family member in town, we're all connected somehow to this problem. That's the preventative measure, right? Like, we know what works, we know what can help people, and I'm not saying everything's successful 100% of the time, but you mentioned the bare minimum. I don't personally know anyone that could go into treatment for 2 weeks and afford to lose it, to not work, or to, pay for that. So, I know a lot of us are in that same boat. A year is what, believe someone's telling us this is how it works. That's a preventative measure. That person's not going to go back. The idea is we don't want that person to be struggling with this for 10 or 20 years, right? Because then it takes an investment, and I think that's when you were talking about preventative medicine, right? Like, it takes an investment. Somebody who, has high blood pressure that's wearing on their blood pressure vessels for 10 years before they go see the doctor, and then all of a sudden they have a major problem that costs 6 or 7 figures to fix. It's definitely the right thing to do. So.
as we're speaking, some of these issues that very much impact rural communities, opioid crisis and other things. I wanted to insert here, and by the way, I'm trying to do the best job I can to insert the questions with the answers from our healthcare professionals as the topics come up. We did ask, what do you think is the most pressing healthcare issue facing Perry County and the 8th District? Dr. Melchior's survival of our rural hospital and maintenance of our current providers. And Pat Karen, lack of access to mental health care, illicit drug use, and the proportion of disease related to unhealthy lifestyle choices. which can often mask other issues, I know. I'd like you to respond. We have been responding to that, and we may continue. Another question is, what should the government's role be in providing access to health care for Americans? Dr. Melchior, I think incentives for non-government care provision by care-related family, churches, businesses, or interested individuals or groups is the most efficient and effective manner for health care provision. In my years of healthcare involvement, I have no confidence in the federal government's ability to effectively or efficiently provide health care. The government could possibly offer an umbrella-type health care policy to supplement a tiered private health insurance system. Pat Karen continues, presently the government requires hospitals to treat and stabilize patients suffering from life-threatening conditions that present to the emergency room, regardless of one's ability to pay. This represents a point of access for emergent situations. And then he goes on, through public health departments, Medicaid, rural health clinics, funding medical education and research, and federally funded health care clinics, our state and federal government improves access to primary care for those with no or limited income. Whether the government should do more is up to debate. So I think even Pat Karen and Dr. Melchior, while both having a much more limited view of the government's role, still see the government's action being highly effective in public health affairs.
Well, one of the reasons that we had the Affordable Care Act in the first place was because all of the churches and the private organizations and all of those kinds of things that were providing insurance couldn't keep the funding level at the need that they needed to have. So that's ridiculous. You know, we've tried that before, it doesn't work. So, you know, I think that we are going to have to really take a serious look at how do we get rid of all of these multiple things that we're trying to do to put this patchwork quilt together and have something that we can all begin to have confidence in by having people who really know what they're doing come up with some ideas that can drastically change the face of healthcare in this country.
Does anybody know how big the healthcare sector is as far as a percentage of our economy? You want to take a guess? Remember? You don't have to be exact.
20%.
It's larger, right? Think about that. You know, Americans are charitable people. We take pride in that.
Is it 50%?
It's 20-ish, right? We can't depend on people's goodwill for that large of a chunk. And that doesn't include the people that aren't currently in it, right? The people that don't have access, people that don't have health insurance, right? It's massive. It's not something that can be done patchwork. It shouldn't be done patchwork. And again, I know I keep saying this, we know it works in other places. Like this is not, we're not creating something new here in the sense that this hasn't been tried before, right? Lots of countries, lots of places have healthcare that works for everyone. They have, everyone's involved. It's not something that bankrupts you. They have doctors that get paid well. They have fine lifestyles. All of these things happen. They reach rural areas, right? And a lot of these things, again, I know I keep harping on that, but you can see that. The other, I'm going to put one more thing. The emergency room is a point of access, right? But again, one of the things that my organization does is collect stories from folks that this is their access for the emergency room. How many of you have been in an emergency room in an emergency? Did that doctor know you? Did they know your past?
Nope.
Were you fortunate enough to be able to tell them your health history and every little thing that you've had? Right. This is not an answer for long-term health care, right? Every time you go, it's a different doctor. Every time you go, the price is different, right? I mean, there's all these things that we have to do and stuff. And one other important thing I think we didn't talk about today that I think the government's role is really important in healthcare, and that is protecting access to people over discriminatory issues. Like, I mean, yes, I'm fortunate that I've had the same doctor for a long time, right? And I know her and I have a relationship with her, but a lot of people don't have that. And, if we allow this patchwork system, or a lot of times we've seen where the private market has failed to protect people that need protection. Like, if we believe that everyone deserves access to health care, there are places in our country where people have problems getting access to health care because of who they are, right? So again, I think you have to keep that in mind when we have these conversations about the government's role in kind of balancing things.
Other questions, Candace? Yes.
One of you all
alternative, is that what she
Well,
said?
I don't know if
As
what the
opposed to
term,
supplemental?
Supplemental.
I think, I thought it was a type of Medicare, but maybe it's a type of supplement. No, but I don't think so. It's a type of, isn't there a privatizing of an option of
Yeah.
private?
It says, it says
Yeah,
associate.
and the wisdom of that is be careful, be very, very careful, because some of those, there's only one, do you remember what that one is that is actually what it says it is?
I don't, but I don't know enough. My mom was paying for 2 when she was, when she went through it, and we didn't realize for a year. She was double paying for stuff from, so it just, I don't know enough, but there are, I don't know enough about Perry County, but I know Jefferson County, there are people that's their job specifically to help people navigate that. Because again, it's part of this thing, it's unfathomable, people trying to figure out they need this. So there's, the idea is you look and say, this is what I need for my plan, and then here it is, there's no doctor within an hour and a half that takes this. And then
Is this being promoted by surely the normal Medicare people at the federal level are not recommending this? Or
Well,
what's
most of these are specifically funded by insurance companies.
Yeah.
So, like, for example, Essence, I think, is the one that you can't go, it sounds really good, you can go to the doctor of your choice. Oh, yeah, but it has to be in our network. So, so you have to be very careful. And you want to find somebody that has good information specifically about, what your needs are, what your financial situation looks like, and, what's going to be the most important plan, significant plan for you that will give you what you need. So yeah, it's a scam. I mean, so much of that is a scam. I wanted to also just reference this article that we actually posted on Facebook. Rural and safety net hospitals prepare for cut in federal support. And they specifically talk about the cut in the community health centers, which are working. So here we go again. Second thing I'd like you to see is that in this particular article, they found over 700 doctors who are paid more than $1 million by drug and medical device companies. So we've got to do something about that. Now that doesn't mean that every physician is going to be, taking that kind of money from these organizations, but it is a huge problem, and that goes right along big pharma and the cost of drugs for that. So, I think we have so many issues that are so important to everyone. Why on earth can we not provide the people in this country what they need, when they need it, at a reasonable cost, in a way that they can actually show up in front of a physician or a healthcare provider and get what they need?
Because that nickel an hour you're gonna take from me is a lot of money to the rich people.
Oh, yeah. They're gonna always have good healthcare.
So it sounds like obviously this is really layered, like it's not just like a 2-dimensional issue, like one act of legislation is not gonna clean the slate. So do you see this requiring like another similar, like kind of like how the Affordable Health Care Act was passed? Do you see this as like a major provisional thing that like you're gonna have, I guess like a major resolution where we say that we're gonna have to work toward, like it's gonna take 5 to 10 years to make sure to clean all this out. I don't know, like what path do you see forward addressing the issues?
I think it's gonna be both and. I mean, I think we're gonna, let's face facts. If things don't work out well in 2020, we're not having any conversations about healthcare. Okay, it's just not gonna happen. If we do, then I think are gonna have an opportunity to really do a drill down in, okay, what does everyone want? And I think, it's kind of interesting because it seems like people are kind of liking the ACA a little bit better these days, that it is working. I know when I transferred over to the ACA, I was paying $1,000, I have a Blue Cross Blue Shield policy, and I was paying $1,000 a month. Now, I was the sole proprietor of my business, and that's the ones they go after. And so, I pay that check. I didn't have anything wrong with me. I had everything, I had a huge deductible even then. When I got the affordable health care, it was $428 a month for the same, it was an Anthem Blue Cross Blue Shield plan. So, there's that. Now it's all flipped up again, but there are reasons for that.
Behind all the discussion of money, boy, it gets complex fast. And behind the discussion of money and what you're going to get or how much you pay and what, is a philosophical question about whether healthcare is a right or simply a commodity. And you can see where those two are heading off to in terms of efficiency. If it's a commodity, you're talking about the efficiency of producing it and all that. And if it's a right, then you're talking about a very different area of our lives. And that's a question we wanted to ask. Do you feel that healthcare is a right or a commodity? Our two doctors have spoken on that. Dr. Melchior reviewed that healthcare as a right has led to a lack of individual responsibility to waste and abuse in the system. And he picked out, as can be seen in a local emergency room or obstetric ward. In order to control the cost, the individual must play a larger role and have a stake in the cost and in the provision of health care. And Pat Karen says, health care is not a typical consumer commodity. It has to be made available based on need up to a certain point. Then as care choices become more elective, it transitions toward becoming a consumer commodity model. So here are slightly different approaches. What would you say? Where should we go with the debate?
I think it's a right. And I people talk a lot about, it's, these liberals that are going around telling you get free education, all that kind of stuff. What I do know is that when people have skin in the game, they have more personal responsibility. So I think that there should be some scale. If people can't afford it, okay, what could you afford? They're gonna, the Bible says the poor will always be among us. That's a fact. There are certain people that will need to be taken care of. But if there are people that want to participate, I've had people that said, I can't afford to pay you any money right now. I've got like $5. And would that be okay? Of course. Of course it's okay. And that 1 hour session meant a lot more to that guy because he had an investment in it. So if we start with, all of the people that are willing to say, yeah, I do want to pay for this. This is what I can afford. Some people won't be able to do that. If we have the ability to provide for the citizens of this country, we will be blessed in many ways. Not just as individuals, but as a country.
Much more eloquent way of saying what I was thinking. We all have stake in the game already. We all pay taxes. We have stake in our government. We have stake in our local government. We have stake in our state government. We have stake in our doctor's office. I don't have to hand my doctor $200 to have stake in the game, right? I have stake in my neighbor's health, my community health. I don't need them to give me $10 for me to care about them, right? We're all, invested in this already, right? Whether my healthcare is getting funded by my employer, which most of my jobs in my life, my employers didn't pay for health insurance, right? I was still working 2 and 3 jobs. They weren't paying for health insurance. So whether they're paying the bill or we're paying it as taxpayers, we're all invested in it already. So I think that's kind of the way that kind of some of those answers are phrased. It's almost a way to say, you need to give me cash for me to care about your health outcomes. It's really not about us as health consumers. It's about the providers and their feelings about who they're giving healthcare to, which I don't think is the way we should kind of frame this conversation, if that makes sense. We're all already kind of invested in it, and there's ways to invest in more than just money. But before I go, I wanted to address the question that was brought up about what do we do, right? And I think, Kathy definitely hit on that as well, but, we're a statewide organization, so I'm going to be optimistic and say, meet with your local legislators, right? We will come help you. There's other groups that will come help you, regardless of their political affiliation. You sit in a room with them and tell them what's going on and talk to them. Whether you think they shrug you off or not, it moves the needle, it has an impact. Write letters to your newspaper, call, talk to your neighbors. Next time there's a healthcare forum, bring your neighbors. Don't think about what they think politically, bring them and get them in the room. Because a lot more people are struggling with this issue and are not talking about it, that we can build those bridges and cross kind of work together towards something, I think a lot more than we may believe because of our own personal political ideas or whatever. So talk about it. Again, I'll be happy to talk to you if you know people in other districts, right? Sit in the room with them, talk to them, come to these, meet people like Kathy that are running for office. Get to know those people, let them know, hey, you're running for office, this is a problem, this is concerns me, right? That's how we move the needle ultimately. So.
Yes, Mary.
You may have to repeat, but what's the reason that Missouri legislature did not take Medicaid expansion? What was their reasoning?
Well,
It had Obama's name on it.
I was confused.
Oh, there must have been something a little more deep.
Well, they have healthcare, so they don't really care.
The official reason is, and this came up a lot, and again, a lot of states didn't expand initially, right? But again, we are now 10 years on. Kentucky, Arkansas is going to do it. I mean, these are not bastions of liberalism that have done this, right? Because it makes sense fiscally. The original argument was, well, this isn't going to make sense. All these new people are, and you're going to hear this when it's coming up in the ballot in Missouri, right? All of these new people are going to come and, get onto the rolls of Medicaid, and it's going to cost us a ton of money, right? There's, again, like I said, the evidence is already out. The best study is the one Washington did, where that's where they came up with the idea that we've now crossed that threshold to where we're losing more money to those other states and covering less people. Like, we're literally paying more to cover less people than it would be if we would have expanded, right? So that was the kind of, I think Kathy's dead on. Nobody wanted to be associated with it politically. They were afraid to bring it up. And, I don't want to be seen supporting, Obamacare or the ACA, even though it was designed in such a way that it really should have not been an issue. It shouldn't have been a partisan issue. Because
Well,
something that's going to help
what's the
everybody.
reasoning now? They have examples from Arkansas and Kentucky that it works for them, so why are we not doing it now?
I think there's people that are ideologically opposed to this that I don't know. I don't know that there's anything we can do about that per se. But I think there's a lot of people. It's really hard to understand how this stuff works, right? I've been at this job for a year now, and still every time I come to one of these things, I learn something. So it's hard for a lot of people to understand how it works. So, and I think it did work.
Yeah, and I think, one of the things that just irks me completely is the fact that the people who are in Congress and in the Senate have a whole different healthcare services than we would ever imagine, plus a whole bunch of other perks that I don't think they need. And when you've got somebody that's got great healthcare, they have a little pharmacy right there in Congress. They can just go over to and do you know what the #1 drug is that they are prescribing right now in Congress and in the Senate? No. That is second. Aricept. Aricept is a drug used for dementia, which scares the hell out of me that there are that many of them that are using that drug. But anyway, they have the best healthcare in the world. If they had healthcare like all the rest of us do, I guarantee you, we would have the best healthcare in the world. So you can't be dividing it off into these are special people who get to have special services. It needs to be exactly like we've got. And if we are sitting there and we're working on how we provide services for people, how we get healthcare for people. Oh, and by the way, I'm losing mine too. That might be a good incentive.
Speaking of Medicaid, just to bring this in with our healthcare professionals, one of the questions was, should everyone be required to have health insurance? Dr. Melchior had said, no, I have not seen that imposed regulations motivate or incentivize people or businesses for the right reasons. The law should provide support and motivation for individuals, families, and business to creatively provide for their own health care and to make lifestyle decisions for their health betterment. Now, this is related to, should everybody be required to have health insurance, which is directly related to Medicaid, right, and being able to do this. Pat Karen follows that, but then the government is attempting to do this with expanding Medicaid and through the insurance mandate. Unfortunately, he feels it is not working throughout the U.S. But then he turns and says, I do wish Missouri had expanded Medicaid and captured the national government funding. I feel it would be better for the economy and made Missouri more competitive with other states in attracting businesses and residents. There is an economic argument that people who are philosophically opposed to the other elements of healthcare reform are on board with. They see that Medicaid was helpful to the local economies, but also helpful to rural hospitals in continuing to function. We had a number of hands go up. Who else was speaking? Candace, did you have a question?
Well, I had the same question Mary did about what are their arguments for not accepting the Medicaid expansion? It did seem to be kind of a bias about Obama and poor people, to me, frankly, in the beginning, but other states, as you all have said, are doing so. And is there anybody in the Capitol that y'all know about that we should, reach out to along with our district reps? I mean, there are some key committee chairs who,
I would ask related to that is that what is the current position of the Republicans in Congress concerning the Affordable Health Care Act? Are they still ready to repeal it, or is it just?
I can't speak to the federal level. Are you asking about the state?
No, I was actually asking about.
I was asking about the state.
I'm sorry.
Selfless plug here, follow our organization, because we're the statewide organization that's doing that stuff. And I think you hit on an interesting point. And it's not, like when you talk about the politics of it, it's easy for me to kind of well, that was silly that they didn't do that. But the political reality is for a lot of people who were Republican legislators at the time, if they would have gotten primary. Like they would have had to then to defend it. So if that makes sense in that political climate, I'm not defending them, not expanding it, but there are realities that play out within our state that I think a lot of them felt threatened by. 10 years have passed. Again, we're collecting the signatures for the Medicaid expansion. I think us collecting those signatures, getting it on the ballot, winning it in November, they'll vote for it. And I think that kind of, I don't want to say let them off the hook, but I think my hope is that a lot of people who are either on the fence or quiet, if we sit in rooms with them, I'll say this before, I'll say it again, sit in a room with your local legislator and let them know this is what we want, right? They start to see that it works and they feel that pressure. So more than anything else. But there's going to be plenty of commercials of people that are going to,
Do you collect the signature online, or do you?
Oh, I have them in the back. I'll do that for you. Yeah.
Can we get them? Because we could take them to work. We have tons of people that would sign this.
Yes.
Do they have to be registered?
Must be registered voters. Yeah, that's the requirement.
Dennis, do you give any information out to people as when you're going to have some sort of testimony being given in some of these committees?
Oh yeah. Well, again, we don't. There was
Be sure to get his information.
2 weeks ago, there was a really good. They had two actually back-to-back hearings where they brought in people from all over our state. They brought in, both sides brought in people to testify about this issue in the Capitol building. So it's happening, and we try and keep people updated as much as possible. So we're moving in that direction.
Well, we got medical marijuana approved with a grassroots stand, and they pretty much figured they had to go along with it, plus look how much money they're gonna make.
Sure.
But what are they gonna do with that money?
Good question.
Let's make
Because
They have a lot of little pots of money that we don't know about.
They're making a buttload of money.
Oh,
I mean, serious.
a lot of them had specifics. I don't remember which one passed, but a lot of that legislation, like I know one of them was specifically had to go towards vets. One of them had to be. I don't remember which one ended up.
They had provisions what they have to spend the money on, or at least portions of it, but I'm not sure which though.
And the same is true of that petition.
Well, it has it
It's
now,
very
all they have to
specific.
do is pass legislation to put that money somewhere else.
Sure, they haven't done that yet,
Yeah.
but as of
And
now.
I'm sure they'll probably try that before they're done, but, I mean, we got that through, I don't understand why we can't get, that's something that so many people were opposed to on a philosophical level, it didn't have anything to do with the money. And we got that through, and I can't believe there are that many people in the state that are just such big potheads that they all voted yes, because if they're that big of a pothead, they forgot to vote. I mean, seriously, but I don't know why we can't grassroots this thing, it doesn't make any sense.
Well, and we are, and I'm anecdotally very successful right now. There's a lot of people that are signing up to it. And a lot of people that, and again, like I said, this crosses a lot of those boundaries that people, that we've kind of, whether you want to say we put around ourselves, or we've allowed them to settle into. I go to these festivals and I see people that are definitely not, as far right as you can be, and they're, oh, that's my cousin. This is something that crosses that boundary, and I think, and again, I'm not stealing with them. Kathy talks about it, and I enjoy you. maybe she'll talk about it now, kind of crossing those bridges and building that community, that this issue is something that, to me, it's a real kind of a benefit just for, whether it's political motivation or just getting to know your neighbors and sharing this experience and letting them know, hey, we're all in this together, let's fix it together. I think it's at that type of issue, so. But again, I'm really big on this, so.
And I think it's also switching the conversation from politics to values. What we're dealing with, it's a value issue. It's about who are we as human beings and what do we want for our children and our grandchildren and the people that we love. What are our values? And when you can talk about those kinds of topics with people, hopefully there will be some consensus. And when there's some consensus, that's one of the things that, we can do very quickly. We begin to work on one specific thing. We're not going to get everything we want. We're not going to get everything that we can need in that particular conversation. But it's a start. So I think that's one of the things that is an important takeaway is that, we really, if we want to change what things are happening in our world, we have to be willing to start talking about it. We have to be willing to, share what to quote the big book, our experience, strength, and hope. That goes a long way.
Further questions? What? Yes,
So-
where do you go?
It's so I think healthcare is really intersectional, right? Like there's a lot of overlap in other areas, whether it's rights or funding or the budget, whatever. And what I personally see, like when I do personal research on our elected officials, especially locally, that there's a lot of money that comes out of the healthcare industry that gets pumped in their campaigns. So I think that is there, and do you see a path forward for kind of reforming that aspect of the system as well, to preventing them from taking so much money? Because I feel like we have these private insurance companies, right, that influence these legislators, especially on a local level, to not opt into Medicaid. So I don't know, what do you have do y'all have solutions to that? I mean, whether it's grassroots work or
Yes, it's grassroots work, but it's also getting rid of Citizens United. That was the worst piece of legislation that has ever been approved by the Supreme Court. That's ridiculous. Just some information here to talk about lobbyists. Currently, 50% of former senators and 42% of former members of Congress and their staff go to work for lobbyists. That's up just 3%. It was 3% in 1970. There are 10,000 registered lobbyists in Washington, D.C. There are 20 lobbyists for every member of Congress. $3 billion a year in cost is given to the people in Congress to vote a specific way. So, yeah, we got to do something. And as long as we got people that are motivated by how much money they're going to drag out of Washington D.C., we're going to have the same trouble.
The only thing that ever beat money is doing it ourselves, right? I mean, that's what the expansion initiative is about. That's what all those ballot initiatives that were passed last year. I mean, it's what I teach government at community college, and one of the things I always tell my students when I talk about Missouri government is you're really fortunate that you live in a state that has the referendum, that has these pathways for citizens to kind of do things, because it's the only way you can fight against that kind of power as people, right? It's the only thing that a lot of it takes a lot, right? It takes a lot of work and effort to do it, but I think it's so worthwhile doing it. I think that's the way to move forward. And again, you meet some wonderful people, so.
Forward. No, go ahead.
I just, aren't our current representatives though trying to take that away from us?
They're trying to make it more difficult, that's for sure. Yeah. And you draw your own conclusions. It's not easy to get a ballot initiative passed, I'll tell you that.
We sound like we're beginning to talk a bit about the future and what we can do. One of our last questions is, what do you anticipate in healthcare for the coming year in terms of what are the possibilities? I know we don't want to talk too loudly about the possibility of changeover in Congress. Politically, that's hard to know. But what might we look forward to?
well, this year, like I said, I think it's all gonna depend on what happens in 2020. And, we could have a revolution, or not. I think, it does get down, we are all so important to what happens, every single one of us. No one is better than anybody else. We have the ability to sit down and talk with our neighbors, to talk with our families. We got the holidays coming up, and that's always a really hard time for me, because everybody wants to come in because they don't like at least half of their family, and they've got problems with them, so they come to the therapist. So it's, we have the ability to talk about our differences, and we have the ability to know when it's not going to work, and you can talk to somebody else. We need to realize that we are all in this together. And people do what they do. One of the things I learned early on when I was in school was, hurt people hurt people. And so what's the hurt that drives somebody to do something that seems so absurd and so cruel? But if we know what that information is, it's a little bit easier then to speak with them about what the real problem is. So remember that ability that we all have, just to reach out.
I think Congress needs a good shrink.
Do I?
I think Congress needs a good shrink. I'm serious, these people, they tell me that they're not flawed when they don't want to help their fellow human beings. That's a fundamental, it's a fundamental flaw.
Well, let's just put it this way, there's a disproportionate number of sociopaths that go into office.
Okay,
But there are also some of us that don't. Some of us can be sociopaths.
I think the next year we're gonna get enough signatures to put them against things on ballot in Missouri. And I think we're gonna vote for it, and it's gonna pass, but that's kind of my own selfish play. But I also think that doing that, I think having conversations like these in Perryville or Huntington or wherever people ask for them and people come participate, it's gonna start to open the issue of healthcare broader, and I think it's gonna help us start to push back, not only against getting Medicaid expanded, but surprise them. All these other issues, think long-term healthcare for elderly Americans, prenatal care, healthcare for young people, all of these other issues that are important, mental health access. Once we do, and I collectively as a state, once we can solve this problem together and kind of work together, then we say, well, let's do the next one. And we can start to push back against some of the things that feel insurmountable, or they're big challenges. Obviously, there's a lot of money working against some of these issues, but I think you build on success. So I think but I think the next year we're going to keep building on those successes. So.
And that's why we want to have events like this. We're going to continue to do this throughout next year. Probably we'll be doing one the day before the election in November. But we would encourage you to talk to people about, what are the issues that are concerning. If you want to do something, it's all across the board. We've got 10 or 12 of these set up now between now and the end of the year. And so it's about things that in some cases, I'm surprised. It's like, that and not that. But that's what people want to deal with. So, we have one that's on healthcare here. We have one that was on recycling. We have one that's going to be on income inequality. We have one that's going to be on childcare. So, there's so many things that I think that the one thing that draws people together as a common issue is the healthcare, because it's involved in all of these things in some way.
Other questions? Well, this has been really helpful personally to me, and I know it's been helpful to you all. I appreciate you all taking the time to come here and help us with this issue. If we have no other questions at this time, we appreciate all that you all have done.
Thank you.
You're welcome.